Cardio-Pulmonary Resuscitation is an emergency procedure that can save lives. Only about 46% of people who experience cardiac arrest receive the immediate help they need. Even more eye-opening is that about 70% of cardiac arrests occur at home. So, if you are giving CPR, you will most likely be trying to save the life of your child, a spouse, or parent. During a cardiac arrest, the heart stops beating. It can no longer pump blood to the rest of the body. Therefore, death can happen in minutes without proper treatment. CPR uses chest compressions to mimic the heart's pumps. These compressions help keep blood flowing throughout the body. Cardiac arrest is not the same as a heart attack. A heart attack happens when blood flow to the heart is blocked. When this happens, the heart muscle is robbed of its vital blood supply and will begin to die because it is not getting enough oxygen. A person having a heart attack can still be talking and breathing. This person does not need CPR, but they do need to get to the hospital right away. You don't need special training to perform CPR. If cardiac arrest happens to someone near you, don't be afraid, just be prepared. This simple video will guide you through the steps of CPR. Step 1. Check the scene for safety. When thinking of safety, most of us consider the obvious things, but hazards could also be something small that you could miss: a wet floor, sharp objects, or a risk of explosion. 2. If a person is lying on the ground, check if they are breathing. Place your ear next to the person's mouth and listen for 10 seconds. This is important because we do not want to perform CPR on a homeless person who's sleeping or a pregnant woman who fainted due to low blood pressure. If someone is unconscious but still breathing, place them in the recovery position and wait until help arrives. Step 3. Call 911. The dispatcher can guide you through what steps to take until paramedics arrive. Step 4. Chest compressions. Place one of your hands on top of the other and clasp them together. Lock your elbows straight and use the heel of your hands to push hard and fast in the center of the chest at a rate of 100 to 200 pushes a minute. You may have heard that Stayin' Alive by the Bee Gees has the perfect beat for doing CPR. Stayin' Alive is 103 beats per minute, which is almost exactly the rate at which chest compressions should be performed. CPR is brutal. You need to push hard. Breaking ribs during chest compressions is common. Don't worry about this. Know that someone in cardiac arrest is dying or will soon be dead unless you intervene. Because of this brutality, CPR is rarely done correctly in movies. They never go deep enough. Step 5. Mouth-to-mouth rescue. This step is optional. You can pause compressions to give the person mouth-to-mouth breaths every 30 compressions. Tilt their head back and pinch their nose closed. Close your mouth over theirs and blow a breath into it. Give a total of 2 breaths, then go back to doing compressions. Paramedics will use a breathing balloon rather than their mouths. If you don't feel comfortable giving rescue breaths, no worries. Compression-only CPR has been shown to be just as effective on those who experience sudden cardiac arrest. Compressions keep the oxygen present in the body flowing to the brain. Many public places now have an AED installed. An AED administers a shock that can restart the heart. They're designed for people who have no medical background. Just turn on the device and follow the voice instructions. Apply the pads. One pad should go on the upper right chest and the other on the left abdominal. If a shock is advised, make sure no one is touching the victim before pressing the flashing shock button. If prompted to begin CPR, follow the cycle of 30 compressions and 2 breaths. After 5 cycles, allow the AED to analyze the rhythm again. Keep doing CPR until medical professionals arrive and take over. Thank you for watching this video. If you'd like to learn how to recognize a heart attack, please watch my next video.